It's just like the way I'm here now. I saw a mail now that they need to pay insurance, travel insurance or whatever it is. I just saw the mail. I've seen the mail between the insurance and the HR. And the last one I saw now, they have paid the insurance person. I was just saying, I was just in copy of the mail. For the new staff that joined us, they need to do their whatever, accident insurance. I just was seeing the mail between the insurance company and the HR. I was just in copy. I saw the invoice. I saw eventually the receipt of payment. They have made the payment. It does not concern me. It's what has to be done. They will just give me reports. We were able to do this, and this. And life goes on. How much is total insurance that they are paying, the accident insurance? I don't think it's up to 20,000 naira. So why would they bring it to my table? Because it has to be done. Okay, so now there are obstacles on the way to performance management. A lot of obstacles we face, right? Common obstacles of moving to management for measurement. Organization does not react correctly to performance results. Now, if you do not even track the results, you cannot react to it appropriately. It's only result that you have that you can track. That's why I gave the example of that 30 minutes time frame. So who gave 30 minutes? So, now, it means that 3 months is enough for you to assess whether it's working or not. But do you have the access to data to track that?
Well, the management team has that.
So you need to ask for that report to do the analysis. So in the last 3 months, how many patients have come in? What is the average time that it took from coming in to going out? Now, you cannot make a change if you do not know how long it takes in every stage of their process. Because you won't know where the challenge is. Is it at the reception? Is it at the point of taking vitals? Or at the point of seeing the doctor? So if by the time I spend 5 minutes at the reception, so I have to wait for like 20 minutes before my vital is taken, it probably means that you have a higher inflow of patients and you have less number of people taking vitals. So that will guide you in recruitment. Okay, if there's just one person taking vitals, so people have to wait for a longer time for their vitals to be taken. Maybe I need to increase the number of staff at that angle so that I can reduce that wait time before the vitals. Now, if the vital is faster and the wait time, the longer wait time is at the point of seeing doctors, then you can look at it, probably you need to increase your doctor or do more of staggering and what have you. Then you can also check the frequency per day. Which day of the week do you have the highest wait time? And which time of the day? So, maybe on Wednesdays you have. So, sometimes some employees do not need to be on your payroll January 1 to January 30. So, our higher inflow is on Wednesdays and Thursdays. So, employ people that work on contracts. Budget is not properly linked to performance. Our budget has to be linked to the strategy of what we want to achieve. Process is important. Our SOPs, process documentation. We need to begin to have our ISO standards, even as hospitals. Not until we get very big. Get your process standardization so that things does not get complicated. I give you an instance. In Nigerian hospital, typical Nigerian hospital, a patient struggles to see his own test results, to see his file. Am I right? Why, sir? If you don't drive your system with data, it will be a challenge. Now, processes are not properly defined. Organizations do not follow any process approach. It breaks the system. So your process is important and what you want to achieve with the process. We had serious challenge even seeing medical results in Nigeria, and I keep asking why. They'll ask you to go and apply for it. I got so angry to write to apply to see our own medical reports. All right? Now, everyone a lot of time work in isolation. And in your team, if people begin to work in isolation, you cannot improve. You need to create a system that allows people to work as a team, because it's a synergy all around. Everybody have their own eating agenda as being a fundamental problem. And this happens a lot even in the public health centers, public hospitals. Eating agenda of everyone is affecting the overall aim of why the system is there. Even as those of us that have private hospital, we should put caution. We should not throw caution to the wind when you want somebody to come and tell you about somebody else. You will create silos in your own business. And people will form stories because they want to be loyal to you. Managers do not know the importance of data and are not able to efficiently communicate to the employees how departmental work is related to the business strategy. Now, how do we overcome these obstacles? Is when they can find it easy to always come back to your hospital. Even if they change where they are living, they will still drive down to your hospital. Something will still bring them. It is that satisfaction. That is why you need to start doing satisfaction survey. When patients come, especially those that are not in critical condition, normal visits, when they are going, just persuade them, beg them, do anything. Don't let the question be too much. 5 questions to just rate it 1 to 5. At the reception, how was the service? 1 to 5. 5 being the highest, 1 being the lowest. At the pharmacy, how was your experience? I don't know if you get the point.
Will that be before or after billing?
He said?
Will that be before or after billing?
After, it could be anything. Decide in your own organization how you want it to be.
Once you bill, there is no satisfaction. Once you bill.
Okay, it's not necessarily about when you bill. It's about, see, when we do customer satisfaction, it's about perception. And if you do a larger number of people, you'll find an average. That's why you don't just ask one person. You ask every other person, and they will know. Those that may not be satisfied is a walk-in patient that has never been to your hospital. But because circumstances pushed him to that hospital, a regular person in the hospital, maybe those on HMO, you are not the one, even the bill is not on them. You will get a good rate, you get your normal rating. But if you look at that challenge and you don't rate it, you will not even know anything. Whether you are doing the right thing or the wrong thing. So it is important to do customer satisfaction survey. It is very key. Because your money will not fall from heaven. Is it going to come from these people? So it is key for you to test how they feel. And your processes has to be intact. Because processes is one of the things people complain so much about. Your processes has to be impeccable. We need to standardize our processes. In fact, hospital processes needs to be a lot seamless. Because people don't have, we should not be like a typical UCH process. You will collect card here in Mile 1. You now go to Mile 10 to go and pay. You now bring the receipt back to Mile 1. They will now tell you that you need to go to Mile 12 to go and register. When you pay, the registration point is beside them. But you must first of all take the receipt back to whether it is deliberate or lack of knowledge. I cannot explain why it is like that. A sick person to exercise. We need to do something about it. So the person that brought the patient, by the time he is done walking around, he will have headache. Unfortunately, there's nowhere close to eat for that person. The person that has headache, falsing. I've been to UCH before. I've been a patient at UCH before, so I know I'm talking practical. Will you know? You know, it's actually a sad story. I was still at UCH a couple of days ago. There is this quarters that students stay. Those that are doing their 1 year, is it? That house officers.
1, 2, 3, 4.
The one that is close to that yes, it's a disaster. In fact, I saw the back. They used tapoli, they used sack as windows. Really? I have the picture. I actually took the picture. It's on my phone. Sincerely, it's a disaster waiting to happen.
I'm not holding brief for this year.
Can they do a proper covering? They are covering it. Agreed. But can we have, you see, the point is this. The point I'm trying to make is this. That is the system that is going to build the future doctors. That system, really. Last year, I know that, because I have many good friends there, that are my mentees, I know that they always take the first 50, best 50 students, right?
Merit list.
Is that?
Merit list.
Merit list. The merit list of 2019, guess how many people accepted? Out of 50, 18 accepted to stay back at UCH. What does that tell you? As I speak to you, I know a lot of them that know that they will make the merit list, but they are not staying. Yes. So what does that tell us?
The future is bad.
The present is bad. The future could be worse if care is not taken. It needs to be expanded. It's a disaster that is already not just waiting to happen, that is already happening. It's getting worse by the day. And they are there comfortably, making laws. How many of them have visited UCH among those lawmakers that are approving the budget? When last did any one of them? You need to challenge them, Association of Doctors. When last did they visit UCH or LUT or any of those hospitals?
Amazingly, they are there.
I don't
They just
think
refuse to see it. Amazingly.
Whenever they say they are coming to UCH, UCH will change.
Yes, they'll do window dressing.
Yes, everything changes when the governor is coming. Maybe he leaves, everything goes back.
Because we talked about mystery shopping. At this age and time, they are not dollars. They are supposed to be smart people. Why should I announce that I am coming?
So that they will get that window dressing and nice house.
It also means they are not ready to make things work.
Yes, that's the main thing. They are not ready.
That's the truth.
They know
I saw what Fashola did in the medical sector in Lagos.
and what they did.
He did a lot of mystery appearances. Why? Because as a governor, he wants to make it work. When he's going for a visit, they would have set up where he will take. He takes them to take another route. This is where we will take to that venue. So they would have patched the road. It doesn't inform them. We just take them to take another route. His car will pull out from the convoy and go and take another route before they know it. He's not a normal person, and things work. So it means that the truth is, they know what is to be done. Sir, they know what is to be done. They just don't want to do it. If they don't know what is to be done, they should resign from the house. So don't let us all pray for them. They don't want to do the right thing. They don't want to. Let us be very factual. They don't. If they don't know, we should start telling them. How many incubators do you think UCH has?
None for now. Working on it.
It's a fact, actually.
If none, where are they from? None.
I know that you're asking the question.
I'm looking at the fact we as doctors are playing on this depreciation.
Thank you. So what part are we playing?
Let me give an example. I've worked in a government hospital before, and for a very short time,